So we are recording. So again, sorry to interrupt, Olivia.
That was basically it. I guess, Sophie, you can kind of like tell us your story or whatever you'd like.
My story, I like that. Okay. So I went to Petaluma High School also, and then I went to the University of San Francisco, and we started like, I did my prerequisites my freshman year, which means like anatomy and microbiology and physiology. And then we had basically 3 years of nursing school, clinicals all around San Francisco. Like, I think we did, you guys can hear me okay too, right? Yeah, okay. I went to Kaiser, UCSF, a few other ones, and then I started looking for work down in LA because it's a little bit hard to get a job as a new grad in San Francisco because they pay so well, so you're very, very competitive. So I came down to LA, still competitive, a little bit less, and so I've been at Cedars-Sinai for a year now. So yeah. But hi. Sorry guys, I'm in a locker room. But I don't know if any of you have any questions or anything, right? I guess I could tell you about the unit I'm on. I'm on a surgical unit. I take 4 patients at a time. So we usually monitor their heart, but this surgical unit is mostly GI, gastrointestinal surgery, and then also urinary surgery and plastic surgery. On the VIP unit at a hospital in Beverly Hills, so I have a very sort of picky and needy patient population, like that's the reality of medicine, is people are going to be sometimes are going to be very needy and kind of demanding, but then you also have a lot of nice patients too. And then I'm interviewing right now to possibly transition into labor and delivery, so I also might be moving into that too. I don't know if you guys have any questions or anything.
I used to work at St. John's. St. John's in Santa Monica.
Sophia, you're on mute.
Me?
No, Sophia.
Yeah, St. John's is the other hospital. We lose her?
She's muted. I'm going to try and...
Sorry. I'm not used to Zoom. Yeah, I said, yeah, I've heard of that one. Yeah. Uh-huh.
So what year did you graduate from PHS?
2015. Which is now, I guess, like 5 years ago, which is kind of crazy. But yeah, I went straight into nursing school right after graduating, which I'd recommend if you know what you want to do. A lot of people do nursing as a second degree, but it's kind of nice if you can just do it like right out of high school.
And you said you did that at San Francisco State?
University of San Francisco. There's a Jesuit one and then a state school. Yeah, but I've heard SF State's pretty great as well. Just I know that with SF State it's public, so it could take a little longer to get into your nursing classes.
Yeah, my aunt did her nursing degree at San Francisco State many years ago, and then worked in San Francisco, and she also did labor and delivery.
Yeah, I hope to do it. It's a happy field, generally a good happy field. What about you guys? So what are your guys' career backgrounds, out of curiosity? I don't know.
So that's a great question. Let's go use the same order that we had before, and everybody want to do a quick run around and share what you are thinking.
I want to be a pediatric trauma surgeon.
I want to be a pediatric oncologist.
I want to be a pediatric cardiothoracic surgeon.
I'm interested in veterinary science.
I'm interested in orthopedic surgery.
I don't really know. I just know I'm interested in medicine.
I'm not really sure if I want to be a PA or a doctor yet. I switch back and forth like every week.
Yeah, I'd say I'm interested in veterinary science. That's my number one.
I'm interested in emergency medicine.
So what did you like best about the school you went to UCSF?
I think I liked that we got to go to a lot of different hospitals, because I think it's kind of beneficial to see what sort of hospital you like. So I got to go to like maybe 5 or 6 different hospitals, and I thought that was really, really cool. And it was really special being able to go to UCSF in Mission Bay, because that campus, I've also been to the Parnassus campus, but both of those UCSFs were really cool. We had a really good simulation lab, so I'm sure by the time you guys are in college, the sim labs are going to be really, really cool. But like, we have like kind of these robot patients, and you sort of practice on them. It's, you know, good to hopefully like get some good practice in with they're like, I don't know how to explain them. They can throw up and cry and like talk to you. It's kind of cool. But I liked the simulation lab a lot. That was really special. And a lot of you were interested in pediatrics. So I did actually have a really good pediatric rotation at UCSF as well. Pediatrics was hard for me, not because of the kids, but because of the family members. Like, there can be kind of hard to like balance having like, you know, talking to the family, because they're also like not at their best, like the parents usually, because they're really stressed out. And then you also have like kids who are usually kind of scared of you. But yeah, that's, I think, what I liked about USF. Yeah.
And how about where you're at now? What are the highlights, and what are the things that you like least?
So with Cedars, really good technology, definitely very, you know, I know right now it's like I think it's number 7 in the United States in terms of rating. So it's a very high rated revolutionary hospital. We have really great technology. We have a lot of help. There's certain things that I would have to do a lot more of in another hospital. Like, I don't really put in IVs. I don't really do blood draws. These are just like nursing skills that you would usually do. But at this hospital, we have lots of specialist nurses. So I think it is a little bit, in a way, a little less work, or you just have more help. And I like that you see people with some of the most complicated medical situations in the whole country, like very, very complicated patients with lots of comorbidities. And that's kind of interesting. But I would say the difficult part is kind of what I talked about earlier. They are sometimes, especially on this floor, they just have very high expectations. And I do have 4 patients, so it can be hard balancing everyone at the same time. That's a lot of multitasking. And we're also a teaching hospital. So definitely in July, when those new residents come around, it can be a little challenging for the first few months of their residency, which is totally normal. They're new doctors, but that can be, I think sometimes being in a teaching hospital is a little bit challenging, like, 'cause so many new people getting trained at the same time. Mm-hmm.
What have you seen as far as changes or differences in the way things are done at your hospital now with COVID?
Well, definitely oh, my patient's getting out of bed. Definitely, obviously the face masks. We don't allow many visitors anymore. For a long time, it was absolutely like no family members unless you were a pediatric patient or a labor and delivery. They wouldn't allow any family members. And now the rule is you can have 1 person per day. We don't have nice hand sanitizer anymore. It's like this hospital made like spray that looks like alcohol. It's like just like this awful stuff that you put on your hands. And for a while, people, I think, were really paranoid and nervous about coming into work. We have a temperature screening every time we come in, and we walk through a thermal camera. And I think really people are a lot more cautious. Every patient gets tested when they come to the emergency room. And luckily I wasn't on a COVID unit, but I've worked on a COVID unit before, because sometimes they move us around. And luckily I wasn't ICU COVID, so it wasn't too hard. But I think the ICU, it was pretty difficult for those nurses every day. But I kind of sort of escaped the pandemic unscathed. I think I got kind of lucky with it. But yeah. Mm-hmm.
All right, I'm going to sit back for a minute. I got so many questions, but I'm going to close my mouth and let you girls jump in.
If any of you guys have questions.
I have some questions. What class that you took at PHS would you say prepared you most for going into nursing school and just for college and medicine in general?
Oh, guys, I gotta be honest with you. I didn't take anatomy in high school. I really regretted it though. But I actually didn't know I would do nursing school until like halfway through my senior year. So it's so great that all of you guys are in this club and you know already, so you can prepare. Because I really wish I had had that preparation. But I would guess that anatomy. I'm not sure if what you guys think, but I would say anatomy. It would have been really helpful kind of coming in and like just having like a general idea, because I was really brand new. And then what else? I think the reason I actually wanted to do nursing was because of career day at PHS. We had like a nurse come in, a labor and delivery nurse come in and talk to us. And I was like, oh, that looks kind of fun. And you only work 3 days a week. So, and here I am. But yeah, take anatomy. I don't know, Tess, maybe you can tell me, do you guys have other like medical related classes?
Yeah, we have a community health pathway program where you have like bio and community health and chem and community health. And then there's like a veterinary science class, but anatomy and physiology is our main medical class.
Yeah, I don't even know if we had that then, but that's great. I mean, just take all the classes, and honestly, like being in this club, I think is like probably really, really great. And then if you ever meet anyone in medicine, doctor, nurse, PA, nurse practitioner, just like ask them, how they like it and like what their job is like. I think it's really helpful talking to people in the career. Mm-hmm.
How would you say the interview process has kind of been, like just as far as either Cedars-Sinai or any of the other hospitals?
That's a good question. I know a lot of you are thinking like residency, like being doctors. So I know with residencies, it's probably a little different, but as for nursing, I went in with a new grad program, which is these really great things. I know that nurses were really struggling kind of just being thrown in and not having, that time to really get used to being on the floor. So more and more hospitals nowadays are doing new graduate programs, where as a nurse you get hired and maybe you're with a preceptor, which is an older nurse who sort of watches over you and makes sure you don't screw up. So you kind of are a team. And I think that lasted 12 or maybe even 16 weeks. I was with another nurse I kind of got mentored basically. But as for the interview process, they actually put us into a giant room with a bunch of other new grad nurses. There was, I think, 30 spots, and there were 70 kids in there, and they lined us up. And all the units were in tables next to each other, so you were interviewing at the same time as other people were interviewing. It was kind of a nightmare. But I think every hospital's different. If you guys end up in nursing, you'll probably at that point do a new graduate interview. Or a new graduate program. But I can't say I really know how residency works. I'm not quite sure how it goes. I wouldn't be the person to ask about that. Any more questions? If not, no worries.
I have another one. What was your favorite class in college?
That's a good question. The obvious one to say was my maternity fetal health class, because that's my interest. But aside from that, what did I like? I mean, my favorite classes were really usually the easy ones, but my favorite class that I think also taught me a lot, should I say? I actually have to say, and I think a lot of people can relate to this, even if you don't want to be a psych nurse or a psych doctor, it's really interesting learning about psych. And it also helps you just with generally dealing with people. I mean, a lot of times your patients have psych issues, maybe just anxiety. So I would say I really liked my mental health class. I thought it was really interesting. And then my community health class was great too, and would have been really relevant now because we had like a pandemic section to it. I don't remember it well now, but I would say, yeah, like I think everyone benefits from that like mental health teaching because it also just helps you communicate therapeutically with people.
Awesome. Thanks, Sophia. I'm glad you mentioned that. And I'll just give a plug to our psychology and sociology course combo at Petaluma High. It's a really great combo. And so I've always highly recommended to everybody who's thinking going into healthcare to take that. So that's a junior senior elective. It's as a regular class, and it's also available as AP. So I highly, highly recommend those. Any of you taken those and want to share? But yes. Ellie, are you in those now?
I took AP psychology last year, and it was, I mean, I really enjoyed it. It was a lot of work, but it was also, like, I enjoyed doing it, so, I don't know, and it was really interesting. Miss Archibald was great.
Yeah, I love Miss Archibald. I had her too. And that was a great class to take because I think that satisfied a prerequisite in school, and that was really, really cool. Like if you can take sociology and psych and get those knocked off for college, it makes your time a lot easier. I think my lunch break's actually about to end at 1:30, but I don't know if you guys have any more last minute questions or if you're all set.
Awesome. So Sophia, would it be possible if someone has a question that comes to their mind later and they'd like to say, oh, I wish I could have thrown it to you. Do you have your contact info that you'd be willing to share with us?
Yeah, that would be totally fine. You guys could, my email's kind of long, but honestly, you guys could text me. I could give you my number right now.
Okay, do you want to drop it into the chat?
Sure. Oh yeah, ooh, yeah, smart. All right, yeah, if anyone has any questions about nursing or anything, feel free. And Livy and Tess, you can also just text me for sisterly things. Okay, guys. All right, so thanks for inviting me so much. Yeah,
thanks so much for coming to talk to us. This was really great.
Thank you. All right, bye guys. Good luck with your future careers. Stay safe. All right, bye.